Well, highs and shine, and welcome to today's education. My name is Dr. Joseph Allen, and we today are going to be talking about dry eye syndrome. Now, we're going to be answering some specific questions about dry eyes, namely what causes dry eye, like what contributes to the initial symptoms and the longevity of why dry eye becomes such a problem. We'll talk about the vicious cycle of dry eye and why it's so challenging to treat and just never seems to get better sometimes. And then we'll also be covering what happens if you just try to ignore it and hope it gets better on its own. Like, what can be the very end stage result of neglecting to treat dry eye syndrome? If this is your first time here to the channel, welcome. We do these live educations every month. With these live educations, they are brought to you by our channel supporting members. So huge shout out and thank you to everybody who's chiming in live as we are doing these live streams here live so you can engage and ask questions. Again, huge shout out to all of not only our subscribers to the channel, but also our channel members, specifically because they make these educations possible. If you want to learn more about how to support the channel and become a member yourself, we'll put additional information either in the chat as well as in the show notes below. So, dry eyes. When it comes to dry eyes, almost everybody will experience dry eyes, at least the early symptoms, at some point in our lifetime. Even just as something as simple as going outside and it's a windy day out, the surface of the eye will evaporate much quicker and you'll experience some dryness and irritation. And maybe it'll only last for a few moments, a few minutes, or maybe even an hour. But thankfully, the human body's really good at detecting that there's a problem. And so you do what? You start to tear up and your body tries to correct for it itself. Now, again, this is just kind of episodic dry eye. It happens now and again to everyone. But the challenge with dry eye disease is that this becomes more than just an initial episode. This becomes a chronic problem, something that's lasting weeks, months, years, and beyond. And so with that, if you ever start to study dry eye, one of the kind of the foundation publications, this is the TFOS DUES 2 2017. They included the vicious cycle of dry eye, this diagram. This will be kind of, it seems really complicated looking at it. If you're seeing our visuals, don't worry too much. We're going to break this down and kind of explain in simple fashion really what's going on. Because it's not, when it comes to dry eye, you want to understand what is all happening on the surface of the eye, because it makes it much better to understand how you can change your life, how certain treatments will be recommended, as well as, kind of helping make informed decisions about your own care if you do see a dry eye specialist to get this treated. Primarily, we think about dry eyes in kind of two steps, right? There's the volume of tears, and then there's evaporation of tears, right? You have the actual tears you produce, and then you have how those tears evaporate and dry out into the air. That's the simple kind of concept. Now, when it comes to tear volume, this is historically what eye doctors and specialists have all sort of thought about as being the main issue with dry eye, is that, oh, you just don't have enough tears. Well, turns out that it's actually not that common. There are some causes, things for people not to produce enough tears. One of those are autoimmune conditions. This includes a famous one called Sjogren's syndrome. This is one that is not only it's an autoimmune condition that not only causes dry eyes, but also dry mouth. And so I'm frequently asking my patients who come in for an evaluation, I'm always asking them, okay, you don't have just dry eyes, but does your mouth feel dry? Do you have challenges swallowing? Do you have to drink water while you're eating food in order to swallow? A lot of my patients who tell me, yes, those are exact things I'm struggling with too, I immediately refer out so that they can get blood work and testing to see if they might have that autoimmune condition. Aging, just getting older, unfortunately, our hormones do change throughout our lifetime. And especially for women over the age of 50 who are entering into menopause, those hormone changes are strongly associated with reduced tear volume and a higher risk for dry eye. Systemic medications. This is another big one that can cause that reduced tear volume or production. And think of it, if somebody's taking an oral antihistamine for their allergies, maybe they're on high blood pressure medications or cardiac medications, or even anti-anxiety and antidepressant medications can all cause a side effect of dry eye and reduced tear production. So that's another big role. Two others, one called reflex block, which is your corneal nerves on the eye don't sense that there's dryness, and because of the blockage, and then you don't produce more tears. Otherwise, your body naturally picks up, hey, I'm dry, make more tears. And then lacrimal block. This is actual physical blockage of the lacrimal gland itself that's producing tears. Fortunately enough, the lacrimal block is not that common. Now, I'm going to be, of course, answering questions. I see some people leaving comments in the live chat, so thank you guys. We will be doing some live Q&A at the end of this education, so definitely stick around, and then we'll see what kind of questions people have. The next big one, I'm going to zoom in on our visual here, is tear evaporation. Again, it's tear volume, how much tears you produce versus how much they evaporate. And the evaporation has a lot of components to it. And so the one big one has to do with the environment, is true evaporation based on the humidity, based on wind and temperature. So if it's really low humidity, like it is here inside my apartment, because we have furnaces on, being it's winter time, so humidity drops and dry eyes happen a lot more. So sometimes people do really well with something like a humidifier in the office or in their place of living, because then that can kind of bring those humidity levels back to a tolerable level. Tear film instability, and we have a lot listed here, and I'm going to work through some of these because these play such a huge role in the development of dry eyes. So the first one I want to kind of talk about here is meibomian gland dysfunction. If you're new here to the channel, then this might be a new term, but if you've been watching any of our dry eye content, we talk a lot about meibomian gland dysfunction, or MGD. It is a leading cause of tear film instability and dry eye syndrome, with over 86% of people with dry eyes having some form of MGD. This is where the oil glands within the eyelid, these are the meibomian glands, and they secrete a little oil, sits on your tear film, prevents them from evaporating. And a little oil is supposed to come out every time you blink. The challenge, for many reasons, and we have other videos, and we'll do even maybe a more in-depth video soon, really going into the pathophysiology of MGD because it's so common. But this is where the oil glands, they become clogged and they don't secrete anymore. And so we see a lot of inflammation, and in our pictures, we have not only image of what those glands look like through infrared imaging, we have the blockage of a gland that wasn't expressing, and then we have a picture of a tool that we'll use in the office in the eye exam to express those oils. And you can see in that picture, it's very waxy. It's no longer a smooth liquid oil. The next one is blepharitis. Blepharitis is also a common condition. This is the buildup of oils, dead skin cells, and then bacteria and other microorganisms which love to eat these oils and this kind of scurf that's left around the eyelids. This will cause inflammation and redness, irritation, burning sensations, and it's really like a buildup of bacteria and other microflora which cause this irritation. And so that's why a lot of eye doctors are frequently recommending, just like people say, hey, brush, like dentists will say, brush your teeth twice a day. Doctors are now recommending clean your eyelids every day. And we have to be aware of how our eyes are reacting to harsh debris that people are avoiding to clean. The next one that influences tear film stability is allergies, contact lens wear, and then vitamin A deficiency. Allergies pretty common. If it's springtime, we see a lot more dry eye come out. If you're a contact lens wearer like myself, that is one of the reasons why you have such dryness, irritation with contacts, especially later in the day, because this tear film is no longer stable. And then thankfully, vitamin A deficiency is very rare. Like true dry eye from vitamin A deficiency, not common, especially in developed countries. People who do develop vitamin A deficiency are usually very malnourished, as well as some people who have digestional issues or have had maybe lap band surgery and you're not taking the appropriate vitamins you're supposed to be. But thankfully, again, vitamin A deficiency, pretty rare, but still a cause. This last one is really important, and that's preservatives. In all of our content that we talk about eye drops, we always recommend non-preserved or preservative-free eye drops when you can. This is because these preservatives, namely a famous one called BAK, or stands for benzoclonium chloride. This is a very potent preservative, great at preventing your eye drop bottles from getting contaminated, but have been found to be toxic to the surface of the eyeball, causes instability of the tear film, and has been found to be toxic to the corneal nerves themselves. So, unfortunately, with a lot of medications for the eye infections and other diseases like glaucoma, these preservatives almost always are in those medications. Not always, but a lot of the time they are. You'll see a lot of, if you're somebody who has glaucoma and takes medications for glaucoma, these eye drops, a lot of doctors and glaucoma dry eye specialists have been turning patients over to preservative-free versions. Downside is they're expensive, but it's still something that a lot of doctors are kind of recommending now because we know long term these preservatives can cause a lot of problems. One great tool that I want to share with you, and if you've been a long time viewer, we've mentioned this in several videos over the last few years. This is a device called the Nano Dropper. I like to share this because I think it's just a really cool, great invention. It reduces the drop size coming out of your eye drop bottle by 70%, which does multiple things. It means less waste because most of eye drops you use in the eye are in fact kind of splash and are too much. So it reduces waste. Because it's using 70% less, it extends the life of the bottle. And because of that, it means you don't have to refill it if you're using medications. So with glaucoma, you can extend the life of your bottle by 70%. That means less refills. That means less cost. It's a really cool thing. Now, Nano Dropper is not sponsoring this content in any way. This is a code says if you want to save 10% on your first order, Nano Dropper has been cool and given this to us for a few years just to share with our viewers. If you put in Allen 10, my last name, ALLEN 10, you'll save 10% off your first order. That is not an affiliate code for me. The channel does not generate any income when you use that code. It is strictly because Nano Dropper is awesome as a company, and they've been giving that discount to our viewers for a few years now. So huge shout out to them for just making an awesome product and helping people. We also use this in the clinic. We use it for a lot of the eye drops we use for therapeutics in the office. So back to this vicious cycle of dry eye, all of this tough damage that's occurring. Again, we've addressed the evaporation and the tear film instability. And so those two things combined, if you have an unstable tear film and then the tear film in the little shallow spots of the tear film that's really just unstable, that evaporates. And that evaporates so quickly that it leaves behind all of the salt, all of the proteins and other electrolytes that are all in your tear film. It leaves them behind. And that increases what is called your tear film osmolarity. So the tear film becomes hyperosmolar, meaning you have a lot more salt in your tears. And when this happens, it touches the surface of the eye and aggravates it, and your body releases inflammatory signals. These signals are in the form of cytokines, tumor necrosis factor, proteases such as MMP9, which is a test that we use in the clinic to know how bad your dry eye is. We can measure MMP9, MAP kinases, and NF-kappa B signaling. This all recruits inflammatory mediators. Basically, your eye saying, hey, help, help, sending these chemical signals out, bring inflammation in to help us heal. And in short term, that's great. But in long term, these inflammatory mediators, they cause damage to the surface of the eye. They reduce the mucus production on the surface of the eye. And that's a mucus that helps it's not just like tears on the eye. The mucus helps kind of glue and hold that liquid of your tears to the eyeball surface. And so these inflammatory proteins damage and stop the release of these mucus, this mucin. And then it causes damage to the goblet cell itself, which makes the mucin. And so long term, you're having this chronic damage to the goblet cells. You're not producing as much mucus, and the tears just don't want to stay on the eye. With that, more exposure, you have cell damage to the surface. And this is when I start to see clinical changes to the surface of the eye. These are pictures from some of the patients that I've seen that are pretty extreme. On the left side here, we have an image of a cornea that we would grade as like a 4+ diffuse SPK, or superficial punctate keratitis. This is as if someone took like a piece of sandpaper and rubbed it up against like a piece of glass. You would see all these little divots that show up. It's like scratched the eye. On the other side, on the right side, you can see just this coalesced spot on the bottom 1/3 of the cornea there. Everything else looks good, but it's all really dense, that dense yellow at the bottom. That, when I see that in the clinic, that tells me that the bottom 1/3 of their cornea is always exposed to air, and they're probably A, not blinking completely throughout the day, and B, that they might be even sleeping with their eyes cracked open a little bit. And so that's just what we see in the clinic as damage occurring to the surface. So you have this inflammation, you have all this damage going on. That's what results in your symptoms of redness on the eye, because this inflammation is causing the redness on the white part of the eye. You have irritation, doesn't feel good. You can have pain, it's truly painful. Because your body's trying to make new tears to fix the problem, you have tearing. You can get fatigue in the later evenings. In fact, my patient yesterday just said, like, I'm having tough time at nighttime. I just want to read, but at night my eyes are just tearing all the time and my eyes feel tired. Well, for her, that was more due to dry eye because it only occurred in the evening when she's trying to read, otherwise not throughout the day. This fluctuation and cell damage to the surface of the eye will cause blurred vision and fluctuating vision, and then light sensitivity is another symptom. With this, again, inflammation, cell damage, you also have your blinking process. Your body's like, I'm in pain, let's blink. Well, this can cause a scratch. If you let me know in the comments if you've ever struggled with dry eye and you just have felt that it is so bad that every time you blink, it feels like you're scratching your eye. Because that's the way I think about it. If the surface is irregular and damaged, it's like having a bad injury on your skin, on your arm, and you're scratching it with your fingernails. That's your eyelid moving up and down. And then finally, you have the reflex tearing. Again, these are the signals. This damage is what's signaling your eye and your brain to say, hey, make more tears. Let's fix this problem. And so that's why you get those reflex tears. This is an important but unfortunate part of this process, is because this inflammation and cell damage, it loops back around, and this itself contributes to tear, problems with tear evaporation and instability. And so with that unstable tear film, it just becomes a complete circle, and that takes us back to the vicious cycle of dry eye, because you have the unstable tear film with the evaporation becomes hyperosmolar, or too much salt content, that causes damage to the eye and signals inflammation. That causes further damage of the mucus production on the eye and damage to the surface cells, which causes more instability, and we're back to the beginning. So hopefully that makes a little bit more sense and gives some more guidance on really why dry eye happens and then why it's so difficult to treat it. That's why if you ever see a new medication that comes out or new treatment for dry eye, it's aiming at one of the things that we just covered. So what happens when you don't treat dry eyes? What ultimately happens? What's the course? So this is just kind of an illustration I'm showing here to show that dry eye and the path of dry eye is not straightforward, and it's not the same for everybody. Usually you'll have some good days and some bad days. And again, let us know in the comment section if you're catching us live, if you've had fluctuations in your symptoms, because some days will be great. And maybe even a few days or a few weeks, you're not really noticing symptoms, but then you have a long night where you didn't sleep well, or it's really smoky outside because of forest fires, or something's going on, you will have a flare-up. It'll trigger things, and your symptoms will get really bad. Your eyes will get red for a few days, and you'll seem like it takes even longer to get back to ground zero again. So that's expected, that things are going to go up, things are going to go down. But on a long enough timeline, if you just ignore your dry eye, let the symptoms get worse and worse, it eventually will spiral and, again, cause more serious damage to the eye. So this is just kind of a list of unfortunate activities that are inhibited in our lives if you really suffer with dry eye disease. And this is important, I like to point out, because if you're watching this, if you're catching this either live or you're catching the replay, I hope that people, if anybody's watching and they know someone that works in the health, not just the healthcare industries, but works with insurance. Here in the US, it seems like a lot of insurance companies don't really care too much about dry eye, or they don't recognize how important treatment is. And just to think of it, when you go through this list, not only do you have symptoms of not being able to wear contacts, that's like the early symptom. You can't apply makeup, so because your eyes are so sensitive. You have trouble reading because your vision's fluctuating. Same thing with computer and phone use. That makes it challenging. Watching TV, enjoying doing simple tasks, driving becomes difficult. Doing things outdoors because your eyes are so sensitive to light, wind, and pollen, exercise, even just holding a job and working, and then social interactions can all be affected by dry eye. So, again, my hope is that somebody out there will see this and they'll know someone who works in insurance and getting healthcare benefits for people and share it with them so that they'll understand how serious dry eye really is. Because there's a lot of doctors and a lot of professionals out there who just still, I feel like, haven't really understood how serious dry eye can be. Give me a second to get some water. Thank you. So, after you get those symptoms and it really starts progressing, the challenge with this path of dry eye is, again, the surface of the eye can slowly be damaged, and it can get so severe where vision starts to become blurry. This is a picture, again, from a patient I've had, and this patient's vision was 20/60. In the state of Minnesota where I practice, they were not legal to drive at that point because their vision was reduced by just their dry eye. Thankfully, with treatment, the dryness improved and they got them seeing 20/20 finally when they were getting toward full recovery. So it was great. Great success for that patient. But it just shows to say how blurry the vision can get. And the real concern is that, again, as this damage of the surface happens, you get reduced visual acuity and pain. So you guys start to get painful and not just blurry. But that increases the risk of ulcers developing on the eye. And that increases the risk for infection. And then ultimately, it can cause scarring on the eye. Now, we're going to show just 2 examples of how scarring can form on the eye. Thankfully, this isn't super common, but I do have patients who have it, and it's called Salzmann's nodular degeneration. So this is where the parts of the cornea that are made of collagen and extracellular matrix, it starts to grow on the surface in these little spotches. And then underneath it, there's for people who want to take a test later, there's a structure called Bowman's membrane, which ends up getting destroyed underneath. But you get these, they're almost like build-up collagen warts on the eye. That's what I'm just going to call them right now, just to describe it. But we see these little white scars on the eye. And this, we don't know exactly what causes them. You know, women are more likely to get it in older age, but it has a strong association with meibomian gland dysfunction and other chronic surface diseases, including dry eye. Unfortunately, when these kind of scars develop on the surface, it becomes kind of bumpy. This changes the surface of the eye and causes increased levels of astigmatism and, again, more blurred vision. Another type of scarring that can occur is called calcific band keratopathy. Again, another one, thankfully, not super common, but I do get patients who get severe cases of this. This is an imbalance of calcium and phosphate that occurs on the surface of the eye, just on the front few surfaces of the cornea. There are many causes to this, including renal disease we have to be aware of, juvenile idiopathic arthritis, just for an example, uveitis or inflammatory conditions within the eye, and then again, dry eye can contribute to this. This can be a full band of calcium that completely eclipses over the eye and prevents you from seeing. So there are, thankfully, surgical procedures to remove these, but still something you don't want. The other big change long-term that occurs on the eye from dryness, and this is when things don't get treated aggressively, they go too long. There's a lot of different factors. But this is because of corneal nerve damage. The nerves within the cornea, there's over 7,000 nerve endings in the front surface of your cornea that feel pain. And that's why small pebble, piece of sand in your eye, dirt, or just wind hitting your eye can be so painful. It feels like there's a huge boulder in there if you have a piece of sand. But that's because there's so many nerve endings. Well, Both dry eye can contribute to nerve damage, as you can see in the visual here. There's a publication, and I have sources underneath if you really want to dig it up and read it. But it shows that damage from dry eye leads to this corneal, the nerves stop growing correctly and they don't grow as robust. Then you also have preservatives in the medications, as well as eye drops. Those preservatives, again, are known to be toxic to these same nerves. So long term, what these nerves can start to change and they can cause some problems. First, they can cause nerve reflex block, which, if you remember back to the beginning of the vicious cycle, one of the causes of reduced tear production is nerve reflex block. Because if you don't have nerve sensation on the eye, you're not telling the brain to make more tears, and so your tears, you don't produce any tears at that point, or very little. Neurotrophic keratitis, and then neuropathic corneal pain. So first, let's talk about the neurotrophic keratitis. This is, again, a tough one, and I hate seeing this in the clinic. We work really hard now to identify this in the early stages. Neurotrophic keratitis, this is where the nerves on the eye stop signaling to the brain to say, hey, or the brain to be able to signal back to the eye, hey, let's heal the eye. Let's repair the eye. And so if you're having this damage from dry eye long enough, these nerves change and the surface of the eye starts to not heal and slowly start to form ulcers. And so this impaired healing leads to ulcers, corneal melting, and then in worst case scenarios, perforation, which is one of the worst things that can happen in the eye clinic. That's when the eyes has an open globe and the content of the inner eye can leak out. This is a major source of infection, which can cause the worst eye condition basically in the world of eye care, which is called an endophthalmitis. So we're always trying to avoid that in any case. So unfortunately, yes, this is can be devastating for some people, so we work really hard at catching it early. The challenge is that the early stages of neurotrophic keratitis look very similar to severe stages of dry eye. It's very difficult to tell the two sometimes. And so that's why myself, our clinic where I practice, and many other dry eye specialists, they're always testing for corneal sensitivity when they do their initial or potential future dry eye evaluations. This can also be somewhat triggered by other refractive surgeries and many other things like infections from herpes zoster or herpes simplex. There's a lot of lists, but dry eye, again, can lead to this. The next one is kind of the opposite. We had the neurotrophic keratitis, where the eye stops losing sensation of the eyeball. But then there's the opposite, where it can have neuropathic corneal pain. And this is where the eye is hypersensitized. Either peripheral nerves of the eyeball are sensing so much sensitivity and pain. Your pain threshold, if you're somebody who thinks you're pretty tough and you have a 10 out of 10 pain threshold, imagine your body just said, no more, we're going to move it down to 1. This is one of the worst things. I have a few patients who have this, and I feel so bad for them all the time, because I can't imagine living every day with their symptoms. Two classic ones: hyperalgesia. This is a hypersensitivity to things that normally will bother somebody's eyes, but their threshold is so low that even just moving through the air, like simple wind. I have one patient who has to wear protective goggles while she just walks down the hallway, because even her walking speed moves air across her eye fast enough that she feels that as like an 8 out of 10 pain. The other component to this is it can also be, the other symptom is corneal allodynia. This is a burning sensation from normal non-nauseous stimuli. So using re-wetting drops on the eye usually feels good, not to these individuals. Just using re-wetting drops, or even just the presence of their own tears, can cause a burning pain sensation. The other component to this is that this may not just be peripheral nerves on the surface of the eye that aren't functioning correctly. It could be central nervous system components. So this means that your brain isn't perceiving the pain correctly, and your you're constantly getting these pain signals firing off into your central nervous system. And then that's where a lot of not just medications for the eyeball itself, but also systemic medications, pain medications have to be involved. So again, really a tragic thing when we try really hard to see what we can do to help people with this condition. This unfortunately can lead to not only troubles with reading, driving, and computer work, but can result in not only needing dark glasses indoors, impaired physical and social function, decreased enjoyment and quality of life, challenges to dignity, increased threat to physical suffering, sleep deprivation, anxiety and depression, and existential suffering. I know this got kind of dark really fast there, but it's true that people who struggle with pain all the time of any kind can really struggle with mental health, with just the challenges of life and being in that pain all the time. And so, as an example, people you may have heard in the news, there have been people the last several years who have had like LASIK eye surgery and then later committed suicide because of the dry eye symptoms. Now, I haven't managed any of those patients myself, so I can't speak to it, but I think it's a good chance that if they had bad dry eye, they probably were dealing with this kind of neuropathic pain. So I think if you are somebody or you know somebody that really struggles with dry eye and you're thinking, okay, maybe it's actually this pain issue, it's that severe, then I do encourage seek therapy, encourage somebody, if you yourself have it, seek therapy, encourage people to try to support them the best you can. Mental health is a big thing. We all have tough times, but people who are going through this suffering have a really, really challenging time. So again, always seek help. Seek help from your local eye doctors, seek help from your family doctors. Again, find professional help to help you with those struggles. So from this sort of end thing, I don't want to start on like and leave on a bad note. The good thing is there is hope. Dry eye is something that's constantly being studied and improved on. There are many treatments and ways to manage it, including lifestyle changes, which I encourage for everyone. Conservative therapies, if you're somebody who doesn't want to go too deep into medications or other surgeries. And then there are advanced treatments, both medications, different in-office procedures, and so there are ways to treat it. And if you haven't done so already, I do always encourage find a specialist, somebody who studies maybe dry eye more intensely and has tools in their clinic to do proper testing. Almost every eye care professional will have experience and fundamental knowledge on treating dry eye, but they just may not have the tools, and it may not be something that they love doing. So it's still, I think it's worthwhile to seek a dry eye specialist. I did do a video last year on giving some tips on how to find a dry eye specialist in your area if you're not sure where someone might be. With that, we also have plenty of previous videos, and we'll have future videos on dry eye, on treatments, updated eye drops that are coming to the market, both medications and over-the-counter, lots of different content. So you can check those out on our homepage. We also, if you're somebody who, again, wants to pursue just vitamin lifestyle changes, we have content on that. We do have a video on a dry eye exam. So I break down all the tests we do in the clinic, what I'm doing that test, like why I'm doing that test, what we learn from that test, and how that influences our decisions about treatments. We also have a longer video going over severe dry eye treatments. If you're someone who's well beyond just doing lifestyle changes and you need medications, that video will explain all the different current treatments that are going on, just so that you are aware what options your doctor may be able to offer you. So with that, I want to say thank you so much for joining in on this education. We are going to switch over to some live Q&A. I do like to give a medical advice disclaimer that this is not a place for me to provide diagnosis. I do not provide treatment. This is just a way for me to provide education, to answer questions, and help out people the best I can. So if you have a question that is about a specific thing that you're going through, I will try to phrase the answer in kind of an educational way that everybody tuning in can learn from. Please, if you have questions, start putting some question marks in front of, and then put your questions, some question marks after, so it'll show us a little bit easier. People who are, everybody who's part of our supporting channel members do get priority when we do Q&A. So huge shout out to our channel members. Thank you guys all for supporting the channel, helping us out on our mission to help people learn about the eyes, keep them healthy, see their best, not just today, but in the future. So with that, thank you guys. I know I'm going to answer just one or two questions that I took down before the chat. Some people who came in early. First was my thoughts on Avenova. Avenova is a brand of hypochlorous acid. Hypochlorous acid, I don't have any to show me here right now, but hypochlorous acid is a cleanser that was originally invented to treat diabetic foot ulcers. What is quite fascinating about hypochlorous acid is it's safer than bleach, but it kills more than bleach. In fact, it's even been found to kill COVID-19. Avenova in general is a brand. There's several other ones out there. In the world of eye care, optometry, ophthalmology, there is sort of a battle between a few companies that claim to have like a patent or a better way of making hypochlorous acid that makes it more stable and pure and more effective versus a lot of other older methods that have been around for hundreds of years to make hypochlorous acid. So there are some battles about branding. But I've used Avenova. I have a lot of patients who use it. I find it's great. I honestly carry some with me when I travel, just because it's an easy way for me to clean my face and my eyelids. So definitely something I personally have liked. But yeah, there are several brands out there, and I don't have any publications for me to quote to say anything is actually better or not. The last question I had quickly was on Sienna glasses. This was somebody asked me what type of glasses are for dry eye. There is a type of there's a brand of glasses called Sienna. They make more. They're probably the most realistic glasses, looking glasses. Like they don't look like you're wearing motorcycle goggles. They just look like regular glasses, but they have an extra silicone insert that's magnetic that kind of create a gasket-like effect around your eyes so that the moisture of your tears don't evaporate into the air as quickly. So that's a brand called Sienna, Zienna, I believe. I may have misspelled that, but that you can certainly check it out online. They have a website, and I know some eye clinics even carry them. So thank you for those questions earlier. Right away, I want to see Emerald Strange. Why do warm compresses and massage make my eyes worse, even though my meibomian glands are blocked? So this is a great question. So there are different things on the eyes. My warm compresses are largely believed to be helpful for the symptoms of dry eye and meibomian gland dysfunction because it melts the thickened meibum and allows that to get out of the oil glands. The challenge is that some people do have, like, it seems like it almost gets worse. It's tough to say if it's making the meibomian gland dysfunction worse. It's probably helping melt those oils, but symptoms of irritation can occur, and it's thought two ways. Well, I should say it's thought that it could be that all of this thickened, inflamed meibum, these oils, are getting on the eyelids and the eyes and causing irritation. So that's one thought. But in my experience, some people, and I can't say this is your case, but some people who are known to have more of a trigger for the heat are people with rosacea or forms of ocular rosacea, which is something that if somebody does put a warm compress on and it just makes it worse, and their face is all red and they kind of break out afterward or have a flare up on their skin, then it could be associated with rosacea. So good question to ask both your eye doctor as well as any family doctors if you have a history of rosacea, if there's any treatments that maybe would be helpful for that. But I always defer. Tell your eye doctor if the warm compresses make it worse, maybe they'll be able to offer better guidance. But hopefully that helps. Thank you. Kat asks, how long should you wait to put eye drops in before reading an eye chart? Honestly, if you're at the eye doctor, it shouldn't take too long. Putting eye drops in a minute or two later, as long as they're not thick gel drops, you should be able to blink a few times and be able to read pretty well. So there's times in the clinic where I'm doing a refraction. I have the big device, the phoropter over your eyes. I'm asking you better one, better two, trying to see where your vision's at. And I'll ask a patient who's having trouble reading, if they'll blink a few times, and does that clear it up? And oftentimes if they say, yeah, everything cleared up, that tells me that they have in fact some dry eye. So I've occasionally put an eye drop into patients' eyes just to see if that helped and stabilized things, and usually it does. It doesn't take very long. Another question from Emerald. Do you recommend scleral lenses for dry eye? Scleral lenses, if you've never heard those before, scleral lenses, large contact lenses that vault over the cornea. They are custom fit for your eye, not just for the power, so your vision, but they are custom made fit for the roundness shape of your eye, because everybody's eye is very different. Those scleral lenses are filled with a fluid, a saline solution, and that kind of gets trapped on the eye. So people with chronic surface disease and damage to the corneal surface benefit a lot from these because it's constantly being bathed in this saline solution and protecting it. It's like the shell covering the surface of the eye. Downside for some people, scleral lenses, if you have bad meibomian gland dysfunction, your oil glands are clogged up, even when you wear the lens, you're still going to have oil problems on your tear film, and that means the surface of the scleral lens will dry out and your vision will still be bad. So a lot of times patients who have scleral lenses or will benefit from a scleral lens for dry eye, we will aggressively treat the meibomian gland dysfunction first or in conjunction with the use of the scleral lenses. But they can be a great option for some people. So thank you for that question. Let's see. I'll just answer this one quick. Quaid, can you do a future video on lattice degeneration? I may be able to do one. I might maybe I'll write that down and do a short on it for people who've never heard of lattice degeneration. It's basically a thinning spot in the peripheral retina inside the eye. So when eye doctors look inside, if I see a patient with it, I'll usually tell them that they have like a stretch mark in the back of the eye where the tissue is sort of pulled and started to separate a little bit. If you could see if you were in school for optometry, you would learn about the liquefaction that occurs above this lattice formation, and that it can increase risks of having a retinal hole, a tear, or detachment form only by about 1%. At least that's what I learned back in school. Maybe things have changed in the last 10 years. But as far as, again, big things to be aware of, floaters, and if you have new floaters, flashes of light, any loss of vision, see a doctor as soon as possible. But thanks for that question, Quaid. Hopefully that helps you out. Let's see. I love this. Pamela, thank you for the question about, are steroids bad for the eyes? Like, how are steroids bad for the eyes? So there are topical steroids are usually used as a form of treatment because it shuts down inflammation on the eye, but it's used as a treatment for dry eye. These steroids, the bad part of them is that long-term, they can contribute to the development of cataracts inside the eye, as well as some people have a steroid response, which causes their eye pressure to go up, and that increases the risk for glaucoma. In addition to this, because steroids, they shut down your immune system a little bit. If you have an active infection, the infection is going to have a better time attacking you because your immune system's not fighting it. And so people who are on steroids for long periods of time, they may be at higher risk of certain infections. So that's the reason why usually steroid eye drops and treatment for dry eye is a short-term solution, because we don't want to be on it for too long. So short-term solution, but long-term, we want to be on safer eye drops, medications, and try to avoid those nasty side effects. So again, great question. Thank you. This is another good question. Emerald, thank you. You just throwing out the questions. I love it. Can atrophied meibomian glands be treated? And can IPL reverse that atrophy? So atrophied meibomian glands, still debated. Right now, there's not much evidence in the research that meibomian glands can be rejuvenated or brought back. Like if they're completely gone, I haven't seen anything. I have heard anecdotal reports from some professionals, and I've seen some pictures that they've shared on kind of doctor groups that I'm on online, where they've showed that typically I've seen it as using IPL to contribute along with other treatments to help get at least some gland that's about to atrophy. It's like almost gone. They're able to get that back, and in a healthier, more vitalitous. Is that the right word? Their vitality has been restored. So right now, unfortunately, I don't tell people that it's possible because I just don't have the evidence to support it. But hopefully, with more research, we will have a solution. So thank you for that question. Quickly again, Emerald, do pinguecula cause dry eye? Can they be removed? Pinguecula is a growth on the eye, usually due to the environment, both inflammation as well as sunlight damage and dryness. It can cause a disruption to the tear film, and so that may contribute to it. If pingueculas get bad enough, cosmetically they can be removed, but it's not something that's usually covered by any healthcare insurance. Dee Dee, let me just say, thanks for the question about the best eye drops. I'm going to say stay tuned because I did a whole video on that and it's coming out next week. So I think it'll go a lot more in detail of different types of dry eye drops, which ones I personally use, which ones I sometimes recommend for patients, as well as some extra tips in that. So I'd say stay tuned for that. So thank you. Thank you. Savan, we have, why do I cry when I'm walking in winter? So I love that you brought this up, because if you've ever noticed, if you do go outside and it's a little colder out, your eyes may tear up. And that's because the corneal nerves on the eye are more sensitive to cold. It's kind of cool. In fact, that's one of the reasons I don't know this for certain, but I believe, so one brand of eye drops at the store is called Roto. And there's a few others that are kind of testing this out, but they include menthol as an ingredient in the eye drops. And menthol has a cooling effect. So I believe that perhaps they made that so that that cooling effect will trigger the nerves to make more tears. That given said, the Roto is not my favorite brand. There's some versions of Roto that do contain BAK, which I'm not a huge fan of. But thank you for that question. Hopefully this is kind of cool info. Let's see, Kathleen, why do you think, or what do you think of Durista? Recommend for glaucoma to reduce preservative. So Durista is new to the eye care scene. This, if I'm not incorrect, this is the new implant inside of the eye for, I believe it's bimatoprost, not bimatoprost. It's a timolol version. It's a beta blocker, I believe. So yeah, Durista. Yeah, it's bimatoprost. So it's an intracameral implant that gets implanted in the eye. From what I've heard, it lasts for reducing the eye pressure for about 3 months, but that's what I believe the FDA has cleared it for. But it can, in the early studies now, or the later studies, they're starting to show that it lasts longer. And so it may be something that will become more popular with time. Do I recommend it for glaucoma to reduce preservative? Certainly, because you're not using eye drops as often. It's all going on inside the eye. Then you don't have to use preservatives as much. So that might be a great option. So thank you for that question. And thanks for giving me just a moment to make sure I'm giving the right information. This is another good question. Emerald, you've got such good ones on dry eye related content here. Do you recommend Soolantra or ivermectin cream on the eyelids to treat Demodex mites? So the ivermectin cream has been shown in studies to be beneficial at treating Demodex mites. However, it has not been FDA approved here in the US for that specific condition. And so, there are some ivermectin creams that I could prescribe for this, but I personally have not reached that, as a lot of other treatments. We now have Xdemvy on the market, which is specifically FDA approved for the treatment of Demodex mites, and I've had good success with that. The other one, IPL, again, not FDA approved for it, but IPL has benefit of killing Demodex mites without having to go on a medication. But ivermectin cream is an option, and I know some doctors who do treat with it, and they have good success. So hopefully that just gives you a little bit more insight on that one. Michael mentioning that he's using heating pads on the eye, like a warm compress. He washes his eyelids every other day. Still has encrusted eyelids in the morning. Is it more than dry eyes? So good question. If anybody's having these sort of symptoms. And it just seems they're trying all these different things to manage it, and it just seems to stick around. Of course, you want to see a doctor to make sure it is just dry eye, because there could be a lot of things going on, a lot more than just dryness. Dry eye often goes hand in hand with other conditions like blepharitis. There's other it could be that your eyelids aren't closing all the way or have exposure issues, maybe sleeping with the eyes open. A lot of times that crusting sleep on the eye that you wake up with, and I should do a video going into all of that. But that crusting is basically the buildup of mucus, mucus drying out and all of the debris trying to flush down toward your nose, and it gets crusted there. And usually the more inflammation, more irritation going on in the eye, the worse it's going to be. Think of if you've ever had pink eye, you wake up in the morning and they're fully crusted shut, and that's because your eye's trying to push all of this gunk and get it out of the eye. So hopefully that gives a little bit insight for anyone who's struggling like that. But thank you, Michael. Real estate prof. Maybe you can give some advice to us on real estate. But what are your thoughts on Xiidra? So I've had success with Xiidra. It's an anti-inflammatory drop that's safe long-term on the eye. It's used twice a day. Myself, Xiidra, found great success with some patients. I've had patients even come back within a month and say, wow, things are so much better. At that same hand, not everybody's a perfect candidate for Xiidra, and some people do get side effects like a bad taste in the back of their mouth, their vision can go blurry for 30 minutes, or they have sight installation irritation or redness. This is common symptoms with a kind of side effects from a lot of dry eye medications, but it's something that sometimes does come with Xiidra. I've had some patients, again, that I've prescribed on it and did fantastic, and it's still something that depending on the case, I will prescribe it. Mainly just, again, to reduce inflammation. Let's see here. I do want to cut ahead here. One of our members, Barb, thank you so much, Barbara Goldfuss. To cataract surgery, doesn't really matter with cataract surgery. So I don't fully understand the question, but I do want to at least kind of address that, with cataract surgery, dry eye sometimes dry eye gets worse after cataract surgery because of all the inflammation and all the eye drops and preservatives that can cause irritation. So we often see a spike of dry eye after cataract surgery. So it's great for people who are considering cataract surgery to use eye drops for a few weeks before cataract surgery, and then continue using lubrication drops with other prescribed medication drops after the procedure as well. But still, thank you for being a member, Barbs. Thank you so much. Robin, I wish I could give more specific guidance to you, but it's something. Robin here mentions that she's had pink eye recently, and that her dry eye's gotten worse. In fact, when we wake up, the eye doesn't want to open on its own, have to pull it open. That's tough, because I know how painful that can be. I, of course, can't say specifically what you should be doing on this, but for people in general, if you have pink eye or an eye infection, that can trigger a flare-up for dry eye symptoms. And so dry eyes can get worse. Depending on the type of pink eye, because there's a lot of different types of pink eye out there. I know some people think it's just one thing. The true term is called a conjunctivitis, and it can be caused by bacteria, it can be caused by viruses. In fact, viruses are even more common than bacterial conjunctivitis. It can get pink eye from autoimmune issues, lots of things. So I always do encourage, if you have a pink eye or eye infection, do see a eye doctor. I know if you're in an area that doesn't have access to that, so you'd rather go to the ER. Doctors at the ER know the basics, but they don't know all the specific ways to diagnose and figure out what it is. And if it's a serious infection, we know how to navigate and test for that. So I always encourage that for pink eye or red eyes. But if you do get a flare up after dry eye, best is to talk to your doctor, see if there is a certain lubrication, like an eye drop over the counter, a gel, or even an ointment sometimes at nighttime will help people get more lubrication that'll last throughout the night, so that when they wake up in the morning, the eye isn't having to peel open. Some people do that with using a sleep mask at nighttime over that too. So they put the gel on, sleep mask. The other forms of treatment for that will depend on what's going on. Because if the dry eye activated something else that's happening, you want to make sure everything's okay. So I do again encourage talk to a local eye care professional on that. But thank you for the question. I hope things get better. Rita, what treatment do you recommend for a chalazion? So chalazion, for again people who have never heard of this, we have a video going more in depth on chalazion, not just pinguecula, but chalazion or other forms of styes, the infection called a hordeolum. That's a painful red, hot infection of the eyelid. But a chalazion's more of like a cyst. That's just the easy way to say it. It's a buildup of inflammatory proteins in the meibomian glands, and it becomes this hard, lumpy nodule on the eyelids. It can be top or bottom. Unfortunately, some people do get these recurrently. The treatments, usually one time, a lot of times chalazions will get better on their own over time. Using warm compresses and heat to the eyelid multiple times a day, following a gentle massage may encourage for that to heal faster. And so those are kind of the old school methods, recommendations to try to get things to heal better with chalazions. Using eyelid cleansers, hypochlorous acid, cleaning the eyelids regularly to prevent future irritation, infection. Try to get oils that are building up on the surface and causing inflammation away from the eye. Otherwise, chalazions, some medications or antibiotics that have some inflammatory benefits for reducing inflammation in the skin, such as doxycycline, azithromycin, those can sometimes be used. However, doesn't always end up getting rid of it. Then there are some procedures that help. Historically, there's a surgical correction where they excise and we have a tool that looks like a miniature ice cream scoop where we first flip the eyelid inside out with a little clamp to hold it in place. And then we use this little ice cream scoop to scoop out all the inflamed globules that are stuck in the eyelid. That unfortunately can leave kind of a scar tissue, can damage the meibomian gland. So it can potentially make dry eyes worse. The other treatment is an injection of a steroid into that same location on the eyelid to reduce inflammation. However, some newer publications have shown even use of IPL using at least 1 up to even 4 treatments can help reduce the size of those chalazions. So that's something that we can offer patients as well. But those are primarily the most common ones and things that I mentioned when people ask about that. So thank you. I know this is an interesting one from Khalil. Khalil Omar asks, do gym sessions and intense workouts worsen eye dryness? I haven't read a specific study on this. Largely, exercise is very good for the whole body and can help move the lymph system, and I believe can help with dry eye treatment for lifestyle changes. As far as really intense workouts, I can imagine, the eyes are going to get dry for a couple of reasons. Namely, because if you're not staying hydrated during those intense workouts, your body's going to be prioritizing water to different parts of the body. And then perhaps sweat and other oils dripping from your face could be getting into the eyes that way and disrupting the tear film. So good question. And hopefully, if anyone does spend some time and find a research article on that, send it my way. I'll definitely read it. And then we'll probably take this one last and call it a good for the evening. Oops, wrong one there. Is Sherry, does putting castor oil on the eyelids help dry eye? So castor oil, there's a lot on the internet about castor oil. And there's, I would say, more probably BS than truth with a lot of the social media trends that you see. When it comes to castor oil, there are benefits for removing makeup, and it can be good on the skin, certain types of castor oil. But as far as eyes, there's a lot there. In fact, I'm doing a video, and it'll be coming out in a few weeks on castor oil and breaking down all of the research publications of how when it can be beneficial for dry eye, and what it can and cannot do in terms of eye health, like based off of published literature about castor oil. So stay tuned for that one. But in short answer, castor oil can be helpful for dry eye, specifically putting on the eyelids. Tough to say, but again, stay tuned for that video because we'll go much more in depth. But thank you guys so much for everyone being on here. I know there's so many questions coming in, and some people did have good ones. I do want to call out Barbara. She's one of our channel members. I got a question a little bit better. Thank you. Is it dangerous to go into cataract surgery with severe dry eye? Tough for me to say it's dangerous, but severe dry eye, the best practice right now is to treat dry eye aggressively before cataract surgery, because the dryness on the surface can make the accuracy of testing of the eye for cataract surgery it makes the accuracy worse because the surface is irregular. But we know that the cataract surgery is likely going to cause a flare up in dry eye. And so we want the eye to heal the best it can. And so to improve the accuracy and the success of the procedure, also to help with the healing, best practice is now to treat dry eye aggressively before cataract surgery. Same thing with LASIK or any form of refractive surgery. So again, thank you guys to everybody who joined in this evening. Please continue to ask questions in the comment section. I will jump in and try to be as active in those as I can. And just everybody, appreciate everything. Thank you so much for watching. Shout out to the gold play button from YouTube for hitting 1 million subscribers. Thank you to everybody, and congratulations to our we had a giveaway for that 1 million. So that is done with now, and we've reached out to all the winners. So thank you all who contributed and joined in that. Again, thank you. Have a great rest of your evening, and we'll see you in the next video.